pancreatitis, it's AIP in short. In Chinese, it's 自身免疫性胰腺炎。It's about 50 years since 1961 when scientists just found this kind of disease. It's chronic inflammatory sclerosis of the pancreas, and at that time it's considered as one type of the chronic pancreatitis. And in 1995, the concept of AIP was introduced as a distinct entity. So in this paper, immunoglobulins and autoantibodies are mentioned, and it's also mentioned that steroid is effective. And in 2001, Mano just associated of AIP with serum IgG4 elevation, and it's a big fund. So what is AIP? AIP is defined as a chronic inflammation of the pancreas due to an autoimmune mechanism, and it's also characterized by enlargement of the pancreas and narrowing of the MPD. And although the presence of antibodies, especially IgG4, is associated, and the fourth one is it's also the histopathology, that the fibrotic change with lymphoplasma cytic infiltration could be found in the AIP. And the last one is it could be respond to oral steroid therapy. So this is about the epidemiology of the AIP. So in 2002, in Japan, there's a nationwide survey. In that survey, it's found that around 1,010,000 is associated with AIP. But in Western countries, it's unknown because there's no survey till now. The table Japan, it's about it tells us that around 5% of the patients of chronic pancreatitis is associated with AIP. So, what is the manifestation of AIP? Like the pancreatic cancer, painless jaundice is the most common manifestation. And besides that, abdominal pain, weight loss, or diabetes could be found. There are two types of AIP. Type 1 is named LPSP and type 2 is named IDCP. And their histopathology pattern is similar. It's called that lymphoplasmic sclerosing pancreatitis. And for type 2, besides this one, there are some here, gel means granulocytic epithelial lesions could be found in type 2 AIP. And there are some common characteristics. The first one is their mean age is older than 50 years old, and for type 1 it's older, it's more than 70 years old. And for the presentation, type 1 patients could be more associated with obstructive jaundice. And type 1 AIP could be diagnosed without histology, and type 2 must be diagnosed with histology. And for imaging, in type 1 AIP, diffuse swelling is more common than type 2. The most important one is type 1 AIP is associated with IgG4 elevation, but not for type 2. And also for the other organ involvement, there are some organs like the biliary tract, kidney, could be associated with type 1 AIP, but not for type 2. This one is the geographic distribution of the two types of AIP. You could see here that the Western countries, especially for the Europe countries, type 2 AIP is more popular, but not for Asian countries, Japan, Korea. This is the diagnosis of the AIP. There are kind of different diagnoses for AIP. This one is the Asian diagnostics. It's drawn by Japan and Korea. In this one, there are some criteria: imaging, serology, histopathology of the biopsy, and also of the resect pancreas. If you could be satisfied with kind of the criterion so that the AIP could be diagnosed. Like this one, I will mention after. This is another diagnostic criteria. It's drawn by the United States in the Mayo Clinic Center. So I will just introduce the diagnosis one by one. The first one is the imaging features. In the abdominal ultrasound, you can see that there's an enlarged gland here, and it's also could be found that it's hyper-aortic. The second one is for the abdominal CT scan. It could be found that there's a sausage-shaped, diffusely enlarged pancreas, like here. And although you can see the thickening of the pancreatic envelope, it's because of the inflammation of the pancreas. And for the MRI, you can see here, although the diffusely enlarged pancreas. And most important one is for here in the T2 weight, you could see a lower density pancreas. And in Asia, it's more recommended for ERCP than MRCP for the diagnosis of the A. Usually you could see a focal to diffuse. Usually diffuse is more characteristic for this diagnosis in the MPD. Like this one, it's the MPD. Second is in patients with focal strictures in the absence of upstream dilation is characteristic. It's different from the pancreatic cancer, because in pancreatic cancer, it's more if there's a stricture in the MPD, there will be a dilation in upstream of the pancreas. Although there will be some CBD associated, like here. This is not CBD; it's the intrahepatic duct stricture in this picture. This is CBD. The second one is the serology criterion. You can see here that in 2001, it found that IgG4 elevation is very characteristic in AIP. And if you choose the 140 microgram scale, there will be a 76% or to 10% of the pancreatic cancer could be found, but usually it's very mild. And this slide is about the histopathology of the resected pancreas. There are four notes about this histopathology criteria, and if all of the notes could be identified, then you could just diagnose the patient of AIP. And the first one is the fibrosis of hip lymphoplasmacytic infiltration, like this one. Adults just towards to the plasma cells. And the second one is the periductal inflammation, like this one. And the third one is obvious between the lilies, like here. And this is the normal anterior. And the last one is the numerous IgG4 positive plasma cells you will find here. And this is all for the histopathology of the it's the biopsy material. So different from the resected materials, in biopsy material you couldn't find all of the points. You could just find the point 1 and point 4. But for the point B and the second and third one, you could find in the biopsy material. So you should combine other clinical manifestation for the diagnosis. And if all the criteria mentioned here, imaging, serology, histopathology of the biopsy of the resected pancreas could be satisfied as 1, 2, 3, 4. So the AIP could be diagnosed. And what you could do when the patient is diagnosed with AIP. So about the treatment, likely that the AIP patient could be responsive to the steroid therapy, and it's just recommended that 0.6 to 1 micrograms per kilogram could be used for patient. And after 2 weeks of the treatment, it's recommended also that the assessment of imaging and CA199 should be just observed. And last one. This is another picture that I found in the thesis in our hospital. It's also mentioned that after the treatment, that you could find that the lesions of the kidney could be just couldn't found after three months later. And although for this picture, after treatment, the pancreas could be shrinked like the normal one, and the CBD. The narrow CBD is normal here, and also for the MPD, it's much more larger here. So this picture is about the differentiations of AIP and pancreatic cancers. If you have interest, you could see it later. This is all the features. So, as a summary, I will introduce again about the disease. It's an increasingly recognized entity of AIP, and the common presentation mimics the pancreatic cancer, and it has the classic histology of LPSP mentioned. And the fourth one, in 2001, IgG4 elevation could be found in most of the patients, and other organ involvement as the extra pancreatic manifestations could be found in this kind of disease. And the last one is about the steroid response of this AIP. That's what I talk about.
Okay, thank you. There is more and more AIP cases found in clinic. So why it is important? Because the clinical features is very similar to the pancreatic cancer. So when a patient with jaundice, and we think it is pancreatic disease, so if we cannot find the mass, low density mass in the head of pancreas, so if the disease is diffused, it's diffused pancreatic disease, so we must keep in mind that maybe it is AIP. So if we have the idea, so we can take more diagnosis. We can do laboratory test for the autoimmune IgG4, and if it's like AIP, so we can take steroid to treatment. So it is important, I think, because it is very similar to pancreatic cancer. In fact, there are several cases autoimmune pancreatitis have performed pancreatectomy in our department. After operation, in a specimen, we can diagnose it is AIP. After operation, in operation, it is very difficult to detect the pancreas and the portal vein. It's very difficult. Okay.